And so I thought, well, if there hasn't been much change, and here's the next chapter, you'll see what the next chapter of this story is all about. I thought, well, if there hasn't been much change, maybe it's because now she's actually ready for sagittal forces. Maybe we've sort of exhausted the lateral plane. And that happens all the time, almost 100% of the time with our lateral arrangements. At a certain point, you have to go back to sagittal. Mm-hmm. I thought, man, maybe last visit, maybe she was already ready for sagittal. And maybe I lost some time keeping her going with the lateral because nothing much changed. All right, let's explore sagittal. So we did. And I had her do sustained prone retraction extension. And I tend to like to do that with the extra pressure of a water bottle under the chin. I find, and this is another little tangent, I've talked about it a lot in the videos of me demonstrating this scattered around the internet, but I find most of my patients are not at end range if they're just pushing into extension with their hands. Yeah. I find most of them have more range than that. They just need longer arms. So we lengthen their arms with a water bottle or with any kind of device that just lengthens your arms. But a water bottle is very convenient, works well. So we had tried that, and that seemed to give improvement. And then just to test something else in sagittal, I had her do retraction extension in sitting with some overpressure, with rotation. And that too seemed to be a green light. So we had these two good sagittal options. I said, well, do a couple of days of one, do a couple of days of the other, see for yourself which one's more effective and stick with that. And here I'm thinking, hey, we're pretty much done here. Cleared the lateral, we're back to sagittal. Let's call it a day, go home, and I think life is good, it's easy. Comes back next visit, she's clearly worse. She got clearly worse with the sagittal maneuvers, which on one hand, is disappointing, but on the other hand, it's very satisfying. Why is it satisfying? Because we've just removed time from the equation, right? She's not just getting better with time. Now she's getting better or worse, and it's because of us. Mm-hmm. She got worse because of my loading strategy. So there's like a certain satisfaction with that, because now 100% for sure you've understood this condition. Mm-hmm. Whereas before, even though she was saying, I'm improving quickly, I love this exercise, you still don't know, is this directional preference or is it time? Now she got worse, great. Part of me is satisfied with that. But also part of me is dissatisfied because we want to get this person, fully reduced and out, doing her stuff at home.
Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.